Breast cancer. Breast cancer is a leading cause of cancer in women with a prevalence of 16%. It is a disease that can affect women of all ages, but the most people who are at the risk are those of 50 years and above. Unfortunately, the survival rate of recent research shows that breast cancer is significantly lower. This is due to the lack of awareness about the importance of early detection and diagnosis. According to data kept by the National Cancer Institute, overall 91% of people with breast cancer were alive 5 years after diagnosis. So the institute organizes the breast cancer survival rate by stages like local, cancer hasn't spread outside your breast; regional, cancer has spread nearby lymph nodes and tissue; distant, cancer is more distant areas of your body like your liver or lungs. So women can detect cancer in its early stages and improve their chances of survival through successful treatment. In this video, we are going to discuss about 10 red flags of breast cancer that every woman should know in order to spot it early for treatment to take place. Now let's explore the warning signs of breast cancer that you should not ignore at all. Number 1. Lump in breast. A lump is often the first symptom of breast cancer. A hard lump with irregular edges is more likely to be cancer, but some cancers are soft and have rounded edges. Often, a lump is too small for you or your doctor to feel. That's why it's important to get regular mammograms if you are over 40 or have a family history of breast cancer. Keep in mind that most breast lumps aren't cancerous. Common lumps are caused by cysts, fibrocystic breast, clogged milk glands, injuries, etc. Nevertheless, any new or changing lump in the breast needs medical attention to rule out the possibility of cancer. Number 2. Swelling in your armpit or near your collarbone. This could mean breast cancer has spread to lymph nodes, small organs that are part of your immune system in that area. This progression of disease is serious, as it indicates that cancer cells have started to move beyond the breast and into the broader lymphatic system. Affected nodes may also be the lower part of the neck or if the cancer is a little more advanced. Cancer cells often use the lymphatic system to invade distant organs. It is the best sign during self-examination. Changes in breast size. Breast can shrink for many reasons, including hormonal changes during menopause or simple weight loss. But if one breast begins to shrink while the other remains the same size, it may be caused by a tumor developing around your chest wall. This pulls in the breast tissue, making the breast appear smaller. Breast cancer can alter the cellular structure of the breast, causing these physical changes. Ignoring this kind of signs or attributing them to hormonal changes or aging can potentially delay a vital diagnosis. Being knowledgeable about such changes can pave the way for early detection and treatment of breast cancer. Number 4. Skin irritation. It's another early sign of breast cancer that is always overlooked. When you see redness or another change in the skin color of the breast, swelling on one side and a rash that appears quickly, sometimes literally overnight, are the hallmark symptoms of inflammatory breast cancer. The skin may also appear scaly or pitted, similar to the skin of an orange. When you see such a sign, visit a nearest health center for further examination and early treatment. Number 5. Dimpling on the breast skin. It can indicate inflammatory breast cancer, as this can look like orange peel. It is also known as pure orange. Breast cancer dimpling can occur when cancer cells block the lymph vessels. Dimpling could be misconstrued as a symptom of an infection or inflammation, especially during breastfeeding. Remember, breast dimpling does not always indicate breast cancer. It can also occur due to fat necrosis. It is important to contact your doctor as soon as a person notices dimpling so that they can receive accurate diagnosis. Number 6. Pain in breast or nipple area. It is common for women to experience pain in their breast or nipples area, especially during menstrual cycle. But persistent and unexplained pain can be a warning sign of breast cancer. Breast cancer can cause changes in skin cells that lead to feelings of pain, tenderness, and discomfort in the breast. If a lump is present, it's not painful, although breast cancer is often painless, it is important not to ignore any signs or symptoms that could be due to breast cancer. Number 7. Lymph node changes. Lymph nodes are small rounded collection of immune system tissue that filter fluid and capture potentially harmful cells. These include bacteria, viruses, and cancer cells. If a cancer cells leave the breast, the first place it typically travels to the underarm lymph node region on the same side as the affected breast. This can lead to swelling in this area. In addition to swollen lymph nodes in the armpit, a person may notice them around the collarbone. They usually feel like a small, firm, swollen lumps and may be tender to the touch. However, lymph tissue may also change due to breast infection or other completely unrelated illness. So, a person should speak with a doctor about these changes so that they can identify a potential cause. Number 8. Nipple retraction or inversion. Breast cancer can cause cell changes behind the nipple. These changes can result in nipple inverting and reversing inward into the breast, or it may look different in terms of its size. The appearance of the nipples can often alter during ovulation or other parts of the menstrual cycle, but people should contact a doctor about any new nipple change. Number 9. Changes to the skin's texture. Breast cancer can cause changes and inflammation in skin cells that can lead to texture changes. Examples of these texture changes include scaly skin around the nipple and areola, as though the skin is sunburned or extremely dry, and skin thickening in any part of the breast. These changes may also cause itching, which people often associate with breast cancer, although it is not common. Skin changes such as nipple scarring may be symptomatic of a rare breast cancer type called Paget's disease. Skin thickening and texture changes may be consistent with inflammatory breast cancer. Number 10. Nipple discharge. A person may observe discharge from the nipple, which can be thin or thick and range in color from clear to milky to yellow, green, or bloody. The discharge typically comes from one nipple. However, it can come from both nipples if both breasts are cancerous. It is normal for people who are breastfeeding to have a milky discharge from the nipples, but it is advisable to contact a doctor about any another nipple discharge. Although most nipple discharge is non-cancerous, it can signify breast cancer in some people. More concerning nipple discharge tends to be bloody, affects one nipple, and is spontaneous. Other possible reasons for nipple discharge include birth control, some medication, and some infection. Number 11. Visibility of veins on the breast. One lesser known sign of breast cancer is the increased visibility of veins on the breast. This condition, also known as superficial thrombophlebitis, can occur when a vein becomes enlarged or inflamed. It's common for veins to become more prominent with age. However, if you come across a new prominent vein that doesn't have an obvious cause, it could be a warning sign of breast cancer. This is because cancerous tumors can disrupt the normal blood flow in the breast, leading to swelling of veins and becomes visible.